Good evening. Welcome to the Bennington Select Board meeting on July 13th, 2020. We are here by Zoom tonight. I'm Donald Campbell, and I'm the chair of this board. I'm going to ask our members to introduce themselves, starting with Bruce, please.
Hi, welcome to the meeting. Bruce Lee Clark here.
Hi everyone, Jean Connor.
Good evening, this is Jeannie Jenkins.
All right. Good evening. This is Jim Carroll. I had the mic off.
There you go.
Hi everyone, Sarah Perrin.
Great. Thanks. We also have with us Town Manager Stuart Hurd and Assistant Town Manager Dan Monks, and Trey Dobson from the hospital is with us tonight. So before we start this meeting, I have to read this one piece, which is that due to the COVID-19 pandemic state of emergency declared by Governor Scott and pursuant to Addendum 6, Executive Order 1-20, Act 92, this public body is authorized to meet electronically. There is no physical location to attend this meeting. However, the public may view it on CAT TV and call in at 1-646-558-8656, entering the meeting ID 868-9225-7479. I'll put that up on the screen in just a minute. If technology fails us tonight, the meeting will be continued at a time and place to be determined. All votes that are not unanimous will be done with a roll call vote in accordance with the law. So the first thing I'm going to do tonight is put up on the screen, as promised, the call-in information. Jot this down if you feel like you might be wanting to call into the meeting at some point. It's a two-part system. You dial, again, 646-558-8656, and then when prompted, enter the meeting ID 868-9225-7479. You'll be asked to press the pound sign once and then a second time, and then you'll be entered into the waiting room where you'll hear music, I think, or you may just be in there silently. But we will enter people into our meeting to offer comment in the order that the calls come in. So again, 646-558-8656, meeting ID 868-9225-7479. Okay, the first order of business tonight is the consent agenda. This is the minutes of July 6th, July 2nd, June 22nd, and June 15th. As circulated, it's also the warrants, which you've all had a chance to look at and hopefully ask the town manager any questions that may have occurred to you, and the liquor licenses. If you have questions on any of these things now, this would be a good time. If not, I would look for a motion to approve the consent agenda.
I have a comment about one of the minutes for one of the meetings. Do you want me to wait till after the motion?
No, go ahead, Jean.
Okay, on the minutes from June 22nd, on line 84, it's when we were discussing being on the Zoom call or not being on the Zoom call with Curtis Reed. I just feel like it should maybe say the majority of the board stated they were not going to be on the Zoom call and they will watch it on CAT TV or Facebook Live.
Well, that's certainly what we intended. I don't know if that's what we said or not. Nancy, do you recall how that went?
I don't. I think I agree with what you just said. You probably didn't actually say it, but if that was intended, I'll certainly make the change.
We, I believe, all watched that meeting, but we intentionally made the effort to not be on the call so as to make room for other people to be on the call and to have our voices somewhat lowered so that other voices could be heard. Any other, thank you, Jean. Any other additions to the minutes? Okay, if not, I would look for a motion to approve the consent agenda as circulated.
So moved.
Second.
Okay, Bruce and Jim, thank you very much. Any further discussion? Okay, if not, please unmute yourselves. And all in favor, please say aye.
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 Okay, consent agenda has been passed. Thank you very much. I'll get you these signed documents later on this evening, Stuart. The second item on our agenda is we're very lucky to have our Chief Medical Officer from the hospital back. I think I've got your title right there, Trey. Dr. Trey Dobson has been a big help to us through this COVID pandemic and continues to be a help with us now. I'd like to say thank you to Sarah Perrin, who's recently been something of a liaison with the hospital and some of the other medical establishments. And it was Sarah's, at Sarah's encouragement that we brought Trey back on. So thank you for that, Sarah. Trey, we're really glad to have you here. And of course, we are all wondering if we're in another rebound or if we're in the same wave or what's happening. And we're anxious to hear what you have to say for our community.
Sure, absolutely. So thank you again for having me. And at any time, whether it's during this time or a phone call or an email, please reach out. If I don't know the answer, I will go looking for it and get back to you. This stuff is complex. I'm going to show you today that there are some good news despite this past week and a half, which has been very difficult, not only nationally, but globally. And recognize that it is complicated, but because, this is what I do and what my colleagues do, we're on top of it, and we want to give information. We want to help people through it, just like I hope people who are in different businesses than I am would help me through situations that I'm not as familiar. So let me share my screen. I have a few slides. I'll try to go through them at a good pace. Please interrupt me or wait till the end, and we can answer questions. We can talk about stuff that's not even on the presentation. And by the way, this stuff does change so fast that some of the slides aren't even exactly what I wanted to talk about tonight, but I'll put some up here. So let's do this and then go into slide presentation mode, and hopefully you can see this. Everybody can see the presentation? Great. So today is July 13th, I believe, which is another way to say that is Pandemic Day 124. You may have heard me say that. But it just is so remarkable to me that it's only been 124 days since the World Health Organization declared this as a pandemic. At that time, there was about 28 deaths, just 28 in the United States attributed to the virus. And now we're, as you know, over 135, approaching 140 probably today, 140,000 people. So I put that in perspective because it seems like about 8 or 10 months or maybe even 2 years has gone by, but it really hasn't. And I also say that's actually some good news, and I'll explain that later. So since the last time I spoke, I believe with this group, and certainly in the beginning, a long time ago, 125 days ago, we talked often about how there's that the virus itself, that we don't know a lot about it. In fact, we ask these questions all the time. What are the symptoms? Do we know all the symptoms? How deadly is it? Do we get immunity? How does it spread? What do I do if I get it? What do I do if someone else gets it? And the good news is that we're finding the answers to these things. And in fact, our answers are pretty solid and for the most part won't change, which is great. Now, there's still plenty of unknowns. So don't think I'm not reflecting on those, but I am reflecting on the fact that we know a great deal in 3 months and 4 months, much more than we've learned about any other disease in the past. And so just focusing on a few things that I know are common sense, but it's how society is going to have to act in order for us to get through this towards a time when a vaccine or other treatment is in place. And by the way, I'll talk a little bit about vaccines at the end, or we can do that on another episode or another meeting. So I also go over this with you because I think it's very important that we have a standard message, and that what one business entity or school system or community member or healthcare provider understands is what the others do, so that we don't have mixed messages out there, because boy, I don't know if you remember this, I certainly do. You would listen to one news source, which would give you a certain advice, and then there'd be another health professional giving you different advice, and then facilities giving you different advice. And so we need to all be on the same page and message. And now we can be, because we've learned so much. So how does it spread? And you may wonder, you might say, yes, I've read this, I understand it, but do we really understand? Do your colleagues in other organizations understand that it's spread from person to person by people who are in close contact? And by that, I mean through respiratory droplets that hang out in the air when you talk, or when you sing, or when you cough, or when you sneeze, or when you open your mouth to begin with. And that the other way it spreads is hand to hand, to mouth, nose, or face. And by that, I mean it doesn't spread on the packages, it doesn't spread on money handed out. It would be very, very difficult for that to occur, and we haven't documented any occurrences. What we've documented are people indoors, close together, talking and getting the virus, or people shaking hands. And that's why we don't shake hands anymore, because you shake your hand, then it lives on your hand, and then it goes to, you touch your mouth, you touch your nose, you touch your eye. These are all really important as we anticipate going back to school, as we anticipate businesses expanding, and how they can do so in a way that limits the risk of transmission. And by the way, you might hear me say this a few times, or you've heard me say it before, but the goal here is not to follow guidelines. The goal is to reduce the transmission of the virus. And when I say that, I even say it to myself, because I get focused on, well, what do the guidelines say? Well, let's do what the guidelines say. The guidelines are there as guidelines, but the whole principle is, how do we go about our day? How do we go about life? Because we have to, and everyone knows that, and have the lowest risk of transmission. So we do know now that it spreads more efficiently than influenza. So SARS-CoV-2, the virus that causes COVID-19, spreads more efficiently than influenza, and that it spreads less efficiently than measles. And we feel very solid about that now. And really, rather than following guidelines to a T, I mean, they're very useful, but just know that the more closely two people interact, and the longer they interact, and the more they do so indoors, then the higher risk of spread. So thinking of it that way helps you facilitate, how are we going to go about getting together socially? How are we going to go about teaching a class? How are we going to keep businesses going? And what businesses do we really have to say, gosh, I don't see how we can do this at a low risk right now, and let's do something else in its place. And that's easier said than done. I understand that. But it does help to look at it from a risk standpoint. So we have this clarity. We have the 5 things that cause SARS to spread, and we could actually stop this disease today. It would actually take probably about 5 to 6 weeks if we could all do these 5 things all the time. And that's simply the hand hygiene every time you go in and out of a group, and several times when you're in a group. You use the hand hygiene. It's the distancing that we all talk about. And actually, this is probably the most effective, is the distance and minimizing our time together in groups. The face masks, indoors always. You don't need to wear a face mask outdoors unless you're within, or you're going to risk being within about 6 feet from people, because outdoor transmission is almost not documented, including in China and in Europe. Where they had of course, they had the virus earlier, so they were able to do some studies, and we're seeing them now. I'll talk more about that in a second. Screening, as we all read about, we can't stop this virus with lots of screening, and the screening, I mean asking people those questions, yes, but testing people too. Testing is a screening tool if you're asymptomatic. And what we really need, and I think everyone recognizes this now, we've been talking about it for a long time, we just need an easy, accurate, inexpensive test that doesn't require a doctor's order at all, that anybody can test. And you can imagine if everybody could test themselves every day, and if they tested positive, immediately isolate or go into quarantine, then we would be able to stop the disease. We're not going to find that test that quickly, but we will get this fall. We will have more reliable, less expensive tests that hopefully we can be doing even in the home, but if not in the home, at least in the workplace and the school systems. I feel very confident on that. I don't know that for secret information. I just know it based on the amount of money going into it and the fact that we can do that with other diseases. It took longer, but we didn't have the effort focused on that testing material. And then finally, the culture. And the culture is the unpredictable part. This is where society, individual members, and groups say, I've got your back, you have mine. I see you're not doing something right. Let me remind you of that. I understand you plan to have a party with 20 people inside your house, even though the governor has given limits up to 25. That's not a good idea. That's where we see the outbreaks. Let's not do that. I tell you, I've gotten much better, but I still, and I'm sure you guys too, have opened your car door and started walking somewhere without your mask. It's okay. You know, you turn around and you get it. If you see somebody, we remind each other. Now that culture, unfortunately varies from region to region, throughout the globe. And it's really important. Without these 5 things, they're all synergistic. We can't do part of them. We can't just wear a mask, but decide we're going to have large parties or go to bars, because the mask won't protect us in those situations exclusively. Then let me just talk about this real quick. What do you do if you get COVID-19? It's important we start talking about this because we've been lucky in Vermont, but we will get COVID-19 here. And I'm going to say that again in the end. We will have, we've had 1,200 positive tests or so. That number is going to double, this year at some point. We're going to have the disease here. And many parts of the country, as you probably know from talking to friends and family, they all have family and friends that have gotten the disease, and we need to accept it more and it not be such a surprise. And so we just need to know, what do you do? What do you do if you get COVID-19? Well, you contact your doctor, you isolate yourself, and then you're probably, for the most part, going to be okay. But you may be sick, and at which point you may need to come to the hospital. So then, if you've got it, when can you return to work and social interaction? And this was the message that was mixed in the beginning, but now is very clear. You don't need to memorize it. You can look it up. You can ask. But if you test positive, you just go and you're asymptomatic and you test positive, you can return after 10 days, assuming you don't develop any symptoms. If you were symptomatic, you can wait 10 days from the time your symptoms developed. And then as long as you haven't had fever within the past 3 days and your symptoms are improving, then you can return to work and you can return to social interaction. And that's important because we don't want people quarantined and in despair and depressed when they don't need to be. Now, we didn't understand this in the beginning, and that's why we had different timelines. Or you can do this thing a lot of people have talked about, which is getting 2 negative tests in a row, at least 24 hours apart, and then no fever and symptoms have improved. There are some problems with this. The first is that people can test positive for months after they get the virus, and they're not contagious. But you keep testing positive, and that resets your timeline. The second is the tests have to be PCR tests. They can't be some of the tests you see at urgent care clinics. And we'll talk about that in a minute as well. And then lastly, unfortunately, with the huge increase in the past 2 weeks around the country, we once again are running low on these testing materials. And therefore, we need to save them for situations that are more important than just trying to get to work a day or two earlier than would be expected. So that top bullet points are where we really need to focus. Now, there are certain situations for civil servants where we can get them tested twice and get them back to work if they are essential. And then a big question is, well, my aunt's best friend's daughter had it, and I did see her on TV once. Do I have to quarantine? What's the situation? And it's a great question. It's very complicated. It depends on the disease, actually. So with COVID-19, there are specific definitions. Again, we didn't have these probably the last time we all talked. So someone who is exposed is, by guideline, an individual who has had contact to a person that has COVID-19 within 6 feet for longer than 15 minutes. Notice there's no mask statement here. That's because the mask doesn't apply in this situation. So if you walked by someone in the grocery store and just waved at each other, then you're not an exposed individual and you don't need to undergo quarantine. But if you have a friend that you were visiting with, you were next to each other for a half hour talking, then you definitely meet this definition and you would need to be quarantined for 14 days. So this is the thing, 14 days of quarantine, or you can quarantine for days. Probably most people have heard this, and then test negative after 7 days. And we've actually done that with lots of people whose family members came down with it, or friends came down with it, or police officers who were exposed from part of their line of duty, or healthcare workers who ran into family who were positive. So we can do this 7 days, test negative, and get back into society and work. Again, as long as our testing supplies are sufficient. Now, I'm going to talk in a minute about risk. So I want you to remember this exposed individual is a person within 6 feet for longer than 15 minutes, and I'll go back to it. So we know these risks now, and life is about risks, and how we go about society, knowing for the next at least 12 months we're going to be living with this, and possibly longer. We've got to go about life, and rather than just focusing so much on the governor's next statement, which, by the way, he's doing an excellent job, so his statements are much appreciated, as well as the health commissioner. It's really about risks and measuring those risks, and knowing that if you're going to go indoors to have interactions with people, including meetings, in your workplace, that has high risk, or at least higher, as opposed to having outdoor encounters. And so you can see the different, I put down the top about 7 things that we need to focus on. And we can't do any more than that because there's too many things to remember. But these are the things to focus on. So when you read about, or you hear about in the media, these outbreaks, almost always, almost invariably, they're in the red box to begin with. Now, maybe the people couldn't help it because it's their line of work. And so I certainly don't think I'm not empathizing with them. Or maybe they just had bad luck and, thought their family member was okay, and they ended up catching it. And yes, that's going to happen. But if most of our behaviors are in the green box, then the numbers of people that will get the disease decreases tremendously. And we can go about life until we get better treatment or vaccine. So I did talk about this last time, but now it's even more clear that we can't be just paralyzed with fear and anxiety, which is something that's come about, over the past 48 hours with the positive cases that we'll talk about. But we also can't be doing what many parts of the country did, and including probably people in our own state. They just got lulled into complacency. They're not seeing badness that occurred in New York, so they take on those red box items of higher risk, and they get lulled into doing that, and that's what happens, and that's when we get outbreaks. Now, again, we have to be careful. I mean, this could happen to me, right? I do the best I can, but I could accidentally find myself in a situation. But that's one situation, and I would get out of it quickly. So my risk is lower than someone who is, again, lulled into complacency and just in denial. Future, there's about 155 vaccines in development in different stages right now. There is one that's actually gone through the stages and been approved. It's rapid. It's only approved for military. It is very unlikely that any of us will see that one unless it turns out to be just incredibly effective and more effective than others. In addition to the vaccines, or a part of that 155 number, are some novel types of treatments or preventative measures, including monoclonal antibodies. So rather than getting an injection of a piece of the virus that causes your own body to mount an antibody response, there are some trials going on with manufactured antibodies. And we have seen this in some diseases, treatments for things like rheumatoid arthritis and some cancers where it's been effective. And if that happens, there's huge advantages. It could be incredibly effective, number one. So rather than a 75% success rate, it could be up towards 100. It could be very inexpensive, and the only disadvantage, and then also easy to distribute. The only disadvantage, if it did work out that way, is simply that the frequency would be much more common. It would probably be about every year that we would have to receive that, but that's okay. Now the outbreaks. What's happened over the past few days, and I want to be careful in saying everything correctly and making sure everyone understands that I completely appreciate people's fears and concerns. At the same time, I want to balance that with we expect this, and I hope that gives some assurance to everyone that we actually expect this to happen at a reasonably frequent level, and actually will increase when the winter comes because people will just be closer together. So what we know is that there was at least 30 positive antigen tests. I'm going to explain that in a second. That were conducted up at the Urgent Care Center up in Manchester. Now, the antigen tests are different than what the state has approved and what hospitals do, and what we do are called PCR tests. PCR tests are highly sensitive. In other words, they pick up the disease if it's present, and then they're highly specific. In other words, they don't tend to cross-react with other diseases. Now, there is some, they're not 100% accurate. No test is 100% accurate, but we feel very confident in PCR tests. In other words, they don't miss very many, and if they are positive, we feel confident that that person actually has the virus. Antigen tests are less expensive, they're rapid, but they're not as accurate. And hopefully they will be soon. In fact, hopefully they will be in this calendar year, and so that we can be doing testing at home or in our businesses, I mentioned. So you probably heard about this, and then you probably went over to the state website and said, wow, I don't see an increase in cases. I mean, that's because the state specifically relies on PCR tests. And so any antigen tests are considered presumptive, and they need to be confirmed, and therefore they're not included in state case counts. So the health department, who I was on the phone with, in the state, just at 5 o'clock here, or 5:30, they're working with all of these individuals who tested positive on Saturday night and Sunday to get them confirmed and get them PCR tests. They've actually, created this clinic in Londonderry on July 15th, and many of the people will go there to be tested. They can also come to SBMC with a physician order to get the test, and I'm sure some of them will. So I feel my guess is that this antigen testing, it's being done. I did look it up 3 or 4 weeks ago. If the tests are positive, those are probably real. They may not be. They may be cross-reacting with other coronaviruses. That's why this is uncertain at this time. But we're going to act like they're real, of course. And I will tell you that so far, none of these people have been hospitalized, and very few are symptomatic, and the ones that are symptomatic have very mild symptoms. So I hope that provides some assurance and some expectations. So I kind of summarized it this way. Rather than being surprised by these outbreaks, our community needs to learn how to accept these, that these are going to occur, how to respond sensibly and appropriately, and then how to participate with the state in containing them through the contact tracing. Now, again, I totally get it. My anxiety level increased last night when I started hearing about these as well. So that's a very appropriate natural response, but they're going to occur. We expect these to occur, so we need to accept that they're going to occur. They're going to occur in the school systems. They're going to occur in businesses. They're going to occur in certain neighborhoods, and we're going to just need to respond to them appropriately. And we can. And in fact, we're lucky in Vermont because we know that our community does respond very well, and that we have a great health system as well to augment that. So as soon as there's an outbreak, we should be able to recognize it quickly, treat those that need to be treated. A vast majority will not need to be treated, especially if they're younger, and get these people quarantined and then get them back into society. And one message here that makes this different than in April is that most people who are at risk are not contracting the disease in this new upswing, and that's because they're smarter than that. They're staying away, and we want to keep it like that because they're the most vulnerable. Then I always close with this, and in my messages, because I don't want anyone to take what I say. If minds are changed and our strategy changes, you can't take what I say tonight as the gospel, because things do change. The good news is they're changing less and less frequently. We're developing good strategies. Society just has to participate. So I will end with that, and we can go to some questions. I'll stop my share here.
Nice dogs there, Trey. That's a good last shot. Are there questions from the board about this presentation? If so, please raise your hands and I'll call on you in order. Jean, go ahead.
Hi, Trey. Thanks for coming. Let's see. I think I have two, but you can almost fold them, both my questions into one. I know, everyone's talking about school reopening and, children. And can you just talk a little bit about the difference between children and adults, the rate that they get sick? Can they transmit the disease the same as adults? And what about teenagers? I'm assuming teenagers are probably very different than an 8-year-old. Mm-hmm. And the other thing, I just want to make sure that I understood what you said. I was wondering why the death rate seems to be dropping, even though the cases are growing exponentially. And I think you just said it's because people are smarter now. Or why? Could you just clarify that? Thank you.
Sure. So I'll if I forget the second one, you have to remind me. But the first one, in regards to children, I will say we do need to learn a little bit more about this before we make definitive comments. I'll give you the theories that are seeming to, or the model, I should say, that seems to be understood and working, and that is that children and teenagers are less likely to become symptomatic because of some reason we don't know. It's likely that they have a better immune response to the virus. If you remember, influenza in 1918, which of course you don't remember that, but you remember learning about it, was the opposite, where the younger people were the ones who were dying and getting very sick, and the older people weren't even getting sick. They weren't even getting symptomatic because their body had seen a similar virus in the past, and so they had an immune response. So for some reason, younger people have a better immune response. And then the second thing is that, of course, they're just healthier in general. So they're less likely for a pneumonia, for example, to put them in the hospital. It just gives them a cough for a few days and then they get better. So to get to your question, if they are less likely to get symptomatic and less likely to get sick, then they are less likely to shed lots of virus in their cough because they're not coughing. And they're less likely to have high levels of virus in their body because the virus starts replicating more and more as an individual gets sicker and sicker, because the body still does defend against COVID-19. And so if someone's healthy, they kind of keep it at bay, and the chances, therefore, of developing these huge numbers of viruses in their body. And you've seen the picture in the very beginning. It's amazing. There's a cell, and it just looks like there's thousands of viruses trying to attack one cell. So you can imagine if you multiply that out, it's billions of virus. So they're less likely to transmit it because they have less volume in there. That's what we think, and it seems to be holding true. It seems that lots of kids get it, and they don't tend to transmit it as easy. But of course, they are transmitting it because they're transmitting it to each other. So it's not something to say, oh, well, the kids got it, but they're not as infectious. I would treat them the exact same. So that's a long answer. The second thing I can do a little bit more brief. So the bad news first, we will start seeing death rates and hospitalizations increase. We already have. And unfortunately, it's no matter what we do today, we meaning Houston, Texas, places in California and Florida, no matter what we do today, we're going to see this keep going for probably 4 to 5 weeks, an increase in hospitalizations and death rate, and certainly an increase in positive tests. And that's because there is this lag time that was thought to be about 2 weeks, but for some difficult variables to articulate, it's actually more like 4 to 5 weeks that the death rate continues to go. I feel pretty strongly it will not go at the same pace and same rate that it did in April for what you just said, and that's because it's younger people, and they even, all these younger people that are getting it, they still know not to go see their grandparents. They still know to wave from the window, and so that means less people who are vulnerable will get it, but certainly some will. It's going to be tough because the media is going to keep hammering on it, and they should, I guess, but it's going to keep hammering on it, and it's going to just cause a lot of despair and depression over the next 3 to 4 weeks because they act surprised, like, oh my gosh, why is this not going down? And we know it's not going to go down. We know it's going to go up for a matter of time, and then it should tail back down again.
Thanks, Trey. That's difficult to hear, but good to know. Other questions from the board? I have one, which is may pertain a little bit to a conversation we're going to have after you go off air, Trey, but I assume it's not within the state's rights to force anybody to take a test. That this is still optional, but taking a test is still 100% optional behavior. And I also kind of assume that the test results are, for the most part, protected by HIPAA laws, at least as far as town and town staff goes. Is that right?
Well, it is. HIPAA is a very strict law, as you know, that is interpreted with a gray approach. In other words, it's not black and white. It is required that certain diseases are reported to the state if the test is positive. So HIPAA doesn't protect someone exclusively, but it does eliminate the ability to figure out if a certain individual has had it. But, businesses can require certain things. If you're in the healthcare business, you can require flu vaccination. And if you don't have the flu vaccine, you can't work there. That's just part of the job, and it's part of protecting patients. So the same is true if the state was interested in figuring out if a population stated they had been tested and stated they were following guidelines, and they wanted to see if that's known. It is possible for them to do that. Again, probably not down to the individual level, but as a group.
Thank you. I don't mean to put you on the spot on that question, but I appreciate your responses. Any other questions from board members? No? Okay. Sarah, go ahead. Unmute.
No question, but a comment. I just really appreciate your time tonight, Trey. Thank you very much.
Absolutely. I didn't mean to leave it with a negative thing, Donald, as you said. I just want people to expect it and know it. And actually, hopefully that gives people assurance. Say, okay, so this is going to happen. And then we need to be able to contain outbreaks quickly. They're going to happen. And that way we can go to work and go to school.
Yeah, I'm not sure it helps anyone to sugarcoat what we're in for here. It feels to me like you're telling a hard truth. We don't really want to hear it, but that's what's coming, and I think I, for one, really appreciate it. I expect other board members feel the same way.
Yeah, absolutely. All right, guys, thank you. Reach out anytime, please.
Trey, thanks very much. Yep, we'll talk to you again. Take care. So we are, just move him. He's removed himself. So we're going to move on to our next agenda item. Actually, before we do that, Stuart, Dan, any necessary COVID updates from the town? Anything that we need to know about right now that the public needs to know about?
I would say no. most of what we're doing, we're posting on our website. So if you've seen the website and what we're putting up, we're still dealing essentially mostly with recreational areas, outdoor areas. We have begun discussions in-house about how we begin to reopen the town offices, but we're not at any stage where we can say we're close to coming up with a plan.
Okay, thanks. I don't know how the rest of the board feels, but my feeling would be, let's not rush that in terms of we need to do the business of the town, but we're not going to be able to do it if the whole town office gets sick. So thank you for keeping an eye on that. Right, so let's move on to if there are no other comments or questions, let's move on to our next item. This is, we're not quite sure what to call it at this point, but at least until the work group asks us to call it something different, I think we're going to call it the Community Policing Update. And so Jeannie, Bruce, and Jean, I know you've been working hard on this week, and there's a training coming up with Curtis Reed, a lot going on. But I'd like to turn this over to you at this point and have you give us your update, however you see fit.
Right, thank you. So you're correct. So Bruce, Jean, and I have been quite busy this week, and we wanted to report on five items and share those. First, the community policing and related topics section of the town website is up. It's very easy to use. You just go to community resources and click on community policing. It includes the scope of work with the Vermont Partnership for Fairness and Diversity. It includes a number of resources from the IACP, including model policies. It includes links to resources at both the Bennington Free Library and also the McCullough Library, and also a link to materials available through the school system. So please take advantage of these resources. Town staff have done a really amazing job getting them all up and making them very accessible to all of us. Second, applications for the research position on community policing and the advisory boards were due today at 5 o'clock. The team, including Jane Connor, Michelle Johnson, who's the Human Resources and Contracts Administrator for the town, and Curtis Reed from the partnership, will review the applications and conduct interviews for the positions. As a result of concerns over the potential for conflicts of interest in working with the partnership, Dr. Mary Gannon, who has joined the statewide Board of Rights and Democracy, will not take part in the community policing work in Bennington. Then fourth, as you mentioned, Donald, a minute ago, the training for the select board, police chief and lieutenant, town manager, assistant town manager, and community development director has been scheduled, and that will take place this week. And then last, we just want to share some information. The June 4th incident that happened at Lake Perrin has been deeply disturbing to many in this community. In particular, the language used by a white adult male toward a young Black teenager, as reported in the July 4th Bennington Banner, is concerning. An adult speaking to any teenager in this manner is certainly inappropriate in our opinion. The unsettling similarity of these reported comments to the actions of the Minneapolis police officer in the killing of George Floyd has made it impossible for many of us not to see this as an act of racism. However, this is not the place for that determination. Although the teenager declined to press criminal charges when asked by the police did pursue the matter and issued a municipal citation for disorderly conduct and also a fine to the male involved. Further, as required in any case where bias may be involved, the incident has been logged into the bias incident reporting system for review by the Attorney General's office. And that concludes our report for today.
Okay, thank you very much, work team, for working on that. Any questions from the board on the report? I think we've got a mountain of homework to do. We've got a lot of readings to do, a lot of TED Talks to watch, a lot of interesting things ahead of us. But I'd like to thank you for your thoughtful report. We share your sentiments, and we're moving forward. So if there are no other comments on that, I think I might take an opportunity to put up this number again. I'm going to put on the screen, this is the dial-in number. If you want to participate in the meeting, if you want to make comments on anything that at any point in the meeting that is appropriate for public comment, this is how you would call in. Dial 646-558-8656 and enter the meeting ID 868-9225-7479. 868-9225-7479. And that will take you into a waiting room. You'll be admitted into the meeting one at a time. When you are, we'll ask you to mute any noise that you have going in the background, the Cat TV stream, anything you happen to be watching, and we will ask you to give us your name and your place of residence and share your thoughts with us. So I'm going to put this down and move on to our next agenda item. This is titled Southern Vermont College Use as a Summer Camp, and this has been difficult. This has been a very fast-moving process. It's been hard on the community. There have been a lot of uncertainties. So I just have a couple of quick things before we start this conversation. I'll turn it over to our assistant town manager in a minute and let him give you some of the gory details. But number one, there are just a lot of unknowns about this. There are things that we would like to know that we can't know right at this moment. We're trying very hard to know as many of them as we can. How the bankruptcy process works, what happens when a board dissolves, what happens when bankruptcy is rejected, a number of different nuanced things that we are getting a fix on, but we don't have 100% fix on. We're working very hard on this, but what we do know is that the town has a very specific role, which revolves around building fire and life safety and any ordinance that might cover the operation. And that's really the limits, as I understand it, and I'll let Dan correct me if I've got it wrong, but that's the limits of what this town can do in that situation. The state retains the COVID-19 oversight and guidelines. So we are really at some level working closely with the state, but it would be up to the state, as I understand it, to take us further. So that's the first thing. The second thing is just that town staff, from my perspective, is doing exactly what they should. This is a private transaction between consenting parties, and the first we heard of it was the June 29th. Got somebody up there almost immediately to look into what permits were needed for building fire and life safety, and have been bird dogging those permits from the very beginning. So I'm pleased with the town's response, although I know that for many of you it feels like not enough. I will say that the noise situation has been difficult. It's not something that is easy to explain away. For many people, it's been one of the most upsetting parts of this is the fact that in the evening there's a fair amount of noise. The town staff has been alerted to this. The town's staff and the police department are working on this. We've prepared it's fully complete, a complaint seeking injunction of public nuisance, a motion for temporary restraining order and a preliminary injunction, multiple affidavits, and a proposed order, which are ready to be dropped in the court's lap if things don't improve tonight. So for those of you that may want to call in and may want to talk about noise, know that we get it, we've heard it, we agree it's a problem, and we're working on it. The third piece is just that it is reasonable to view this as strictly a COVID issue, that it's really about people being afraid of COVID. And and not an anti-Semitic position. COVID's scary, but this board during this conversation just will not tolerate any anti-Semitic speech during our meeting. We understand your concerns. We understand the community's concerns as far as they go with COVID and the health issues, and trying to mitigate that and work with the state and work within the law to control that. But that's as far as we will let this conversation go. In many ways, we're lucky to have people that are interested in the Southern Vermont College campus at this point. So that's my introduction, and I would like to say, you know how to call in. I have one person in the waiting room, but what I'm going to do is I'm going to let the assistant town manager give a little presentation about the current state of affairs, and then we'll take any questions in the order that they come in. So Dan, go ahead. Hope I didn't steal any of your thunder.
Well, Donald, thank you. And in fact, you did a really good job of summarizing most of what I'd hoped was the information that was relayed today. I will follow up on a couple of things. With regard to the COVID-19 guidelines that the state of Vermont has imposed for summer camp, we are working very closely with the state because we have inspectors in the buildings looking at fire and life safety code issues. So they see what's going on and they see the numbers in the dorms. And we've reported all of that information onto the state, and they're evaluating it and determining whether or not they need to take any measures to reduce the numbers or to modify any behavior. As you stated, the town does not have any enforcement authority with regard to state COVID-19 guidelines, but we do take it very seriously and have relayed the information on to the state that we've observed. I will say that the camp director indicates, along with their attorneys, that they understand the requirements and are complying with them. And we're relaying what we see so the state can make a determination of whether that's in fact happening. I would also like to say that we have been in multiple conversations with our attorney, who has engaged with the camp director's attorneys regarding the impact of the bankruptcy and the dissolution of the SVC board on their use of the property. So we are looking into those legal issues as well, whether or not that will impact how and if they can use the property, continue to use the property as they are. One very important thing that I think folks really need to understand, we want them to understand, is that if this sale does proceed, the proposed use of the property, and we're not even sure what that is yet, but if the proposed permanent use of that property will require a full review locally, both by staff and by the Development Review Board, and it will be, meetings will be open to the public. The public will have the opportunity to comment, and they will also, interested parties, almost anybody in the community actually, would have the opportunity to appeal any decision if they were to feel that their concerns weren't dealt with. So I don't want folks to think that the use of that property will not have, the permanent use of that property will not be reviewed locally, and that there won't be judicial review of that if there's indeed concerns that are not resolved at the local level. So I want folks to understand that. I want folks to know that we're continuing to monitor the situation and reporting what we observe to the state. At the same time, we want to be fair to these folks, and they've been very polite and responsive, and we hope that we can continue to work with them. But the noise issue in particular has been a real concern that remains unresolved. And as Donald mentioned, we have prepared all the documentation and are ready to file as early as tomorrow if the noise issue is not resolved this evening. And if it continues after that, we're ready to file. We have communicated this directly to the camp director's attorney. They understand the seriousness of the concerns, and we hope that the noise will stop this evening. But again, if it doesn't, we're prepared to proceed with a judicial enforcement action. And as you know, we can't predict what the judge will do, but we feel like we have a really strong case and a very specific noise ordinance that protects the public. So we're hopeful if we're unable to obtain voluntary compliance that the judge will help us to get an order to protect the folks that are dealing with the noise issues up there. I'm sure I missed something, and so if you have any questions that I haven't addressed, I'd be happy to respond to those, both from the board and any from the public.
And I'm going to start with the board, if that's all right. I see Jim has his hand up, so in just a moment, we'll start with them. There are a couple people in the waiting room, so we'll bring those callers in just a minute. I see 3 of you in the waiting room at this point. But Jim, go ahead with your question, and then we'll, if there are no other board questions, immediately we'll move to the callers.
Thank you, Mr. Chairman. This is a question for both either Stu or Dan. You know, there rumors are rampant around town, and I think we've all done our best to tamp them down. But any change in use for the property at SVC, there have been rumors that they're going to come in and build condos there, would require them to come before the DRB, the Design and Review Board, for any change in its current status. Is that correct?
Absolutely, Jim. The only thing that would require review by the Development Review Board is if a new college or university were to, buy the property and continue to operate it as such. But any other change, however minor, will require review by the Development Review Board, and also, the public will have the right and opportunity to participate in that review, as well as be able to obtain interested party status to appeal any decision. So yes, that's absolutely correct. Any change to the use of the property will require local review with possibility of judicial review if necessary.
Okay. Second, I'd like to quote from an email that Dan sent to Senators Campion and Sears that I think pretty well sums up the sentiments of many of us. So if I may, and this is from Dan, it says, yes, it would have been helpful if the SVC trustees, the community bank, and or summer camp organizers had worked with the town to communicate the plans for the property to the community, but the town has no control over transactions between private entities, regardless of how important to the community the property involved may be. The private parties chose not to telegraph the use of the property, which was probably not the best decision, but it was their decision to make. The accusation of a lack of transparency on behalf of the town is simply not true, and furthermore, does not help to address the concerns that residents may have. Thank you.
Thanks, Jim. Dan, those are your words, so I assume you have nothing to add. But Jean, I see you have your hand up. Would you like to ask the question?
Yeah, just super quickly. I know there was an issue with access to the Bats Trails changing. I'm just wondering what the situation is with the Bats Trails.
Maybe I should speak to that, Dan. I don't know. Would that be comfortable for you? Yeah. So
that'd be great, Donald, because you're on top of it with the Bats folks.
Well, so I should, in full disclosure, I am the treasurer of the Bats Group, the Bennington Area Trail System, and I'm also I work for the Vermont Land Trust, as most people know. So the Vermont Land Trust does have a permanent conservation easement on the wooded area above the mansion. Pretty much everything above that area that goes to the top of the mountain is under a permanent conservation easement, which does allow for designated pedestrian access, and there are several trailheads that lead to that. So the Vermont Land Trust is confident. We have reached out to their lawyers. We've reached out to their staff. We are confident that our legal restrictions will hold up for this buyer or any other buyer. So there may be a little period of transition during this while we figure out who owns it and what happens. But as I say, Vermont Land Trust is confident that access will be maintained. Not all access necessarily. The Hops and Vines Trail is not on conserved land, so that may or may not be available to the public. But the second part of this report would just be that Brad DeBoer, the president of the Bennington Area Trail System, BATS, has reached out to Mr. Rothstein, and they had a good conversation, and they decided that they would like to work together towards continuing to provide public access as much as is possible during the COVID era. So we are confident that public access, although it may be briefly interrupted during this period of transition, that it will be maintained either through this owner or some other owner if this group does not end up being the final owners.
I guess that's great information, but what about while the camp is the campers are there, and assuming that the boys are coming for another, it was the access to the trails during the camp, I guess is what I was.
Yeah. Well, it gets a little bit detailed, but access to the trails is still allowed through other entry points, but the entry points through the campus itself. Remember that the lower part of the campus is not conserved, and there is not there is public access through that, but it's a somewhat more cooperative. In other words, there's a back and forth between what used to be Southern Vermont College and the people that are maintaining the trails. So at this point, the Bennington Area Trail System has decided that it's in the best interest of everybody for the spread of COVID, not to mingle walkers and campers, and to keep those two populations separate, and to not have trails going through the middle of what is now the camp. Again, temporary situation. I think something that will be worked out over time, and the permanent public access will be available, but it briefly interrupted while we get through this. So, Gene, I'm not sure there's a good answer, except that it seems like it makes sense to keep, for the sake of quarantine, everything Trey just talked about, to keep everybody a little bit separated by distance. That makes sense?
Yeah, it sounds like there was much ado about nothing. You can still get to the Bass Trails.
There's to do about something. You can't walk up the main drive, so-called main drive, that goes up to the old mansion without going through the middle of the camp. And so people have gotten kind of used to that, kind of used to being able to do that. Southern Vermont College was great about allowing people to walk everywhere. And there's, some negotiations about what that looks like now, at least for the 6 weeks out of the year while the campers are there. And I think maybe it makes less sense to be waltzing up the main drive at this point. And, they have security issues for their young students too, so they have some questions about that. It's a bit of a work in progress, but long-term, confident that the public access will be maintained over time. So got a couple people in the waiting room. Jim, you have your hand up again, but if you...
I'll be brief. I'll be very brief.
You'll be brief. We'll take you, and then we'll move to people,
okay.
That callers. Thanks.
I had a question from a constituent about access to the campus and how it was being protected. And we had repeated assurances from Mr. Pearlstein that the Sheriff's Department, and in fact, was monitoring it. And I went ahead and contacted the Sheriff's Department and spoke with Captain Andy Hurley, and he said, and I quote, "The camp at SVC is paying the Bennington County Sheriffs for the security." So there are verifiable security measures being taken, and at the expense of the camp organization. That's all.
Yeah, the camp are paying all the operating costs of that place right now, including security costs. That's right. So if I can transition, just Dan, did you have anything you wanted to add before I move to the callers?
No, I look forward to questions from the public.
Okay. So I am going to begin admitting callers here. I've entered a caller into our meeting, and this caller ends in 037. So caller, before I unmute you, I would ask you to please turn off your computer or turn down the volume on however you're listening to this meeting, so that we don't have a feedback problem when I unmute you. But I'll go ahead and unmute you, and please give us your name and tell us where you live and tell us what's on your mind. Caller, welcome to the Bennington Select Board meeting.
Hi, this is Lynn Mazza from Bennington calling. Going back to the report about community policing, it was said that this is not the place to call out the racism that happened at Lake Perrin. And I'm wondering why not. I'm wondering why this isn't the place to discuss it. I mean, if it looks like racism to everyone who looks at it, why aren't we calling it racism in every forum, in every level of this system? I mean, how can we move forward if we can't even say the word? And I guess that's more of a rhetorical question. I don't know that I'm expecting anyone to answer that right now, but I think we need to take a real look at how this process is happening.
Okay.
And you know what? I'm just going to hang up and take my comments off the air.
Okay. Thanks, Lynn. Jeannie, I see you have your hand up. Why don't you go ahead and, I know this is out of sequence. I know we're talking about Southern Vermont College now. I'm just going to remind everybody this platform is hard. It's difficult getting the call-in times right. There's a lag. Let's just be flexible here and go back in time a little bit and have you respond to the previous item.
Yeah. So and I welcome Jean or Bruce to jump in as well. But Lynn, the reason that this is not the place is that no one in this board has seen the police report. And the purpose of logging any incident that might involve bias in the reporting system is so that the Attorney General's office, which does have the resources to provide, another set of eyes and do the research that needs to be done to look at it. So it would absolutely be speculation, any conversation that we had at a board level. We are not equipped to be the people to make this decision. What we can say is how we read it, how we read it in the banner and how it struck us. Beyond that, that's my personal opinion, and as well as any other person on the boards or anyone in this community. So the purpose of logging it into the database is so that it alerts the Attorney General's office that there is an incident that they should review. And this was advice that we were given and a proper way to proceed with this. So that is what we are doing.
Thank you, Jeannie. And this would be different if a complaint had been filed or there had been some other piece like that then would come to us in our role as a Citizens Advisory Board. Okay, so we are now going to fast forward back to Southern Vermont College and the conversation about the uses that are happening up there. I have two callers. I'm going to enter the first of these two callers that are waiting in line. Caller, welcome to the Bennington Select Board meeting. I'm going to ask you before I unmute you to please turn down the volume on your computer or your radio, however you're listening to Cat TV, so there's not a noise conflict. And please give us your name and tell us where you live and tell us what's on your mind. So welcome.
Hi, Don, it's Mary Morrissey. You didn't say the last three numbers or digits of my number, my phone number, but am I on?
Sorry about that. You are on, Mary. That was my fault.
Okay.
But
no,
you are
not
on,
a problem.
and thank you for joining us tonight.
I just didn't want to be speaking if it wasn't my time, so thank you. Obviously, as you know, I am calling tonight in regards to the Southern Vermont College issue. And since Sunday, July 5th, my phone has literally been ringing off the hook, as well as I've received numerous emails from concerned citizens. I think I can summarize it by saying the concern has been all about the health issues, the protocols that our community, our citizens have been pretty diligent about following these last almost 4 months when we've been virtually shut down as a community. And so where it comes to is, I think it feels a little bit, and yes, you folks didn't know, the town didn't know till the 29th, and yes, from what was all said tonight, we wish that Southern Vermont College had obviously reached out, and yes, we wish the camp directors would have done the same. because obviously I want to make sure we would be promoting what could have been a front page story in the banner talking about something possibly normal that might have been happening in our community that a camp was going to be running. And unfortunately, with how this has happened, it is appearing to most people, and as I said, most of the people that have reached out to me have been very concerned that about how this kind of slid under the radar and up on the Hill. I have heard a great deal from, obviously, the residents, certainly nearest to the college. Also, I have heard from quite a number of people out on the West Road, all who are extremely concerned with what's going on. Many of us have heard the noise. The promises have been daily from the director of the camp that these were going to be resolved. But it's, I think, most disheartening for me as I've talked with people, and I don't want to hear the hearsay or the assumptions. I want to know the facts of what's going on. You may not be able to actually answer some of the questions, but I think, as I said, what is the most hard is that folks have followed the COVID-19 protocols very closely. And I think we keep hearing the tests have been taken, were taken before. The report that I got from the commissioner of the Department of Public Safety, and it has been in the banner, was that, obviously we have 350 campers here, but before, when the testing was done, and that was changed a couple of times, or the dates were changed. First it was May and June, and then we were told that it happened closer to when folks left New Jersey. 16 of the folks that were tested were positive and were not allowed to come. Almost 50 have results that they did not want to share. Supposedly they did not come either. But again, the interaction, usually groups or camp groups or I guess what I'm wanting to say is especially summer groups often are together in different settings. So in going forward, the concern has been almost everything in our community, from our own camps for our children, our youth, as well as sports camps have been canceled. Everything from weddings to funerals to graduations to fairs to festivals have all been closed as well and canceled into the future. And so presently we are hearing the testing on the campers will happen weekly. Does anyone on this board know how the weekly testing is being done? Did anyone see any of and again, I know HIPAA, they don't have to with some of this, but did anyone ever see any of the actual reports as to when these tests did happen? So that, again, we're just all following protocol. I have no, hidden agenda here. I just want to make sure that as this camp is here, that we are protecting our citizens as well. So at this point, has anyone received or seen documentation from the directors of the camp as to when the tests were actually done?
I'm going to turn this over to Dan. Mary, I may have interrupted you inadvertently. I'm sorry. Were you finished?
No, I have a couple more comments, but I'll wait to hear from Dan.
Okay, so look, Dan's been working. He's been the interface with the state. As I understand it, trying to work with the governor's orders and whatever state direction there is. Dan, can you take this one, please?
Sure. So I also want to say that Paul Danzero has provided a lot of information to the state. So, Mary, as you probably are aware, the legislative delegation, including you, I believe, but I know for sure that the two senators have reached out directly to the Attorney General's office, Agency of Commerce and Community Development, and the Department of Public Service, and asked them to monitor the situation, determine compliance with the state's guidelines. As I mentioned previously, the town, although we are reporting what we see, has no authority to enforce those guidelines. So if the state wanted to see these reports, I don't know what authority they have. They certainly could request them. We have been told by the camp directors that those tests were done. There's no way for the town to confirm that if they're not willing to give us the test. They also have told us that they quarantined 2 weeks before they came into the camp. Again, we don't have any way to confirm that, but we have relayed that information to the state, and the state has in fact reached out to the camp directors and asked these same questions. All have been reiterated to the state. To date, the state has remained satisfied that the camp is in compliance with the state of Vermont guidelines. I don't know if that will continue. But again, we are reporting what we see and asking the state to take appropriate action. There's really no other measure that we can take as a town because we don't have an independent authority to enforce the state guidelines. I will say the only really concrete state guideline besides quarantine before or during the camp is the 75% limit on occupancy of the existing, we believe, the existing beds that are on the property. All the rest of it is pretty much recommendation. So the state has chosen not to take a real strict tact on some of these things. And so they're limited, even they are limited in what they can do to enforce their own guidelines because a lot of them are recommendations. But we have reported to the state what we've seen, and we are asking them almost daily to let us know if there are any concerns that they have. And to date, they have not taken any action to modify either the numbers or the behaviors of the campers. And that's where we are right now.
Right, and I'm been certainly involved with all the different agencies in the governor's office in regards to these issues. But again, in today's paper, it was said testing would be done. And when testing is done across the state, it's done very specifically, sanitized, and under a very strict control, and it has to be tested in an appropriate place. So I, again, don't want to have hearsay from anyone. Don't want to certainly have, I think if we're working as trying to be a partnership or good neighbors, that we would not just be putting statements out there as it sometimes appears, and I mean no disrespect necessarily to the director of the camp, but you can't just make statements and then not really even see that some of this is being done, which is very disappointing. The other obviously issue that you did somewhat address was, of course, the concern with the noise that I certainly have heard at my house, that many in the community have heard. And once again, that has been challenging when we thought that was resolved last Thursday when our police chief, Paul Doucette, spoke with the camp director, and it was promised, and I'm getting an email, 3 or 4 emails at 11:30 that night that the noise was still over the top. You had commented earlier, Dan, and I kind of had to chuckle. You said that the director was being very polite and responsive. Well, I really don't think that's necessarily being polite or responsive, doing that to surrounding neighbors if you really want to be a good neighbor. I think that more of the overall concern for folks certainly, again, has been the health concerns for our community. I hope with what we're being told, even though it's can't be proven, is accurate. I also have had questions, and again, it's appearing to me that some of this, I don't know if people are actually aware of it or not, but we have heard I have heard the statements being said that there has been some additional kind of construction going on up at the mansion. Is that something that can be confirmed or not at this point? Because the mansion is under the historical preservation, and would have to go through definite permitting, a very specific permitting based upon being historical. So has there been anything that has further gone on?
So I can address that, Donald, if that's appropriate. So our building inspector, Paul Danzero, has actually walked through personally the entire mansion and all the buildings around it. And there's been absolutely no work whatsoever done to the mansion or any of the buildings, the bookstore, any of the adjacent buildings. In fact, it looks like the day that SBC just shut off the lights and left, there has been no activity whatsoever of any kind inside the mansion or outside the mansion for that matter. And in fact, there's significant concern because there is already noticeable deterioration of the interior of that building from leaks, et cetera. So there is no construction being taken or happening at this time, and actually even not any maintenance to the roofs or anything, which is desperately needed. But so that's the situation on the mansion. Mary, I would like to address the noise issue just to get, once again, you say you received emails. I would say to everyone listening tonight, and hopefully if you do get emails again tonight, Mary, that you ask them to please contact the police department so that we can document it with a citation that'll help us with any court action that we have to take. Of course, we're hoping that we don't have to take one.
Well,
Go ahead.
It was sad, and I didn't mean to interrupt, Dan. It was sad this morning. One of my constituents from the neighborhood up there had called me to ask me on something else this morning, and as we were talking, we were just about finished, and all of a sudden in the background, it would be as though someone turned their TV up to the most extreme highest level that came into the background, and I couldn't even hear the person I was talking to. And he said, when it died down a little bit, he said, Mary, I can possibly adjust to this during the day, but we hear this at night into the late evening. And it was just hard to see that folks who are just kind of coming out of the coronavirus kind of lockdown, that their summer is being challenged by having to listen to this in their own backyard. These are tax-paying citizens that, don't normally complain about anything, and they're having to listen to this virtually night and day. So I am hoping that we get a handle on this somehow, because I know it does go way above what our laws allow as far as noise. I think one last statement I'll make. I think from everyone I've heard, they're very concerned about the future for that property. So, and again, I know there is a process that goes, along with anything, especially in approaches, but this has not been a good week and a half for a lot of people in the community. But I do thank you for, even with the additional building, as I said, I don't want to deal with hearsay or assumptions of what's going on up there. I just would like this to hopefully come down, and that, we can get through the summer and on a good note. But I thank you for the answers that you put out there.
Mary, before you ring off, I'm not sure if this is the case. I don't want to get into a legislative back and forth, but Jim has his hand up. Jim, do you have a question for Mary, or do you have a comment that you want to make in light of what Dan has just said?
Just a comment in light of what Dan said. And
okay. I'm going to say thank you to Mary then. She did a nice job of wrapping up her comments, and well taken, Mary. We understand it. We agree with it. We're on it. The noise complaints can't keep happening. The town staff is really taking this seriously. Even if we get an injunctive relief, it takes a while to have that take place too. So we're working through the channels that we have to try to make this better. And we completely agree that it needs to get better. So
thank you.
Thanks for your call. Go ahead, Jim.
I just want to say that I've probably fielded many of the same calls that Representative Morrissey has gotten. And I spoke with many of those folks and communicated them to Stu. And to address those noise complaints, the one thing that we left out in notifying the police department is a phone number. And I'd like to do that now. If there are noise complaints, the phone number to the police department is 442-1030. And if you hear it, call them. We need to know. Secondly, Stu, you and I spoke about, one of the rumors was that the mansion was being used as a dormitory. And the chief went up and did, from what I recall, was a surprise inspection of the mansion, and there was no evidence of that. Can you confirm that?
Actually, I don't believe it was the chief that did that, and it wasn't a surprise. Paul Dancero, our building inspector, scheduled an inspection of the entire property, and he can confirm that there is absolutely no work going on in the mansion.
Okay, my mistake, but the facts on the ground still remain the same.
That's correct.
Okay, thank you.
So, Mary, Representative Morrissey, thank you very much. I'm going to put you back in the waiting room so I can bring the next caller in unless you have any further questions.
No, I appreciate it. Thank you.
Okay, thank you. So I'm entering a caller into the meeting at this point, and caller ending in 439. Oh, this is Mary again. Why is this? I think this is Mary Morris is still. I'm going to put her back in the waiting room. Caller ending in 994. I've entered you into the Bennington Select Board meeting. Welcome. Before I unmute you, I'd ask you to please turn down the volume on your Cat TV stream, whatever that is, so that we don't have dueling noises. And I'll unmute you here, and please give us your name and tell us what you're thinking about. We're talking about Southern Vermont College at this point and taking comments on that. Thank you very much. Welcome, caller.
Hi, my name is Hannah Messer, and I am a Bennington resident. I know a lot of people have raised a lot of questions about COVID and the concerns around, the people that are occupying SVC, but my question is a little bit more into the future looking, and I'm thinking if they were to purchase the property, would they be expected, the group that's up there now, would they be expected to pay property taxes like the rest of the property owners in Bennington, or would they have the ability to evade paying the property taxes because they are a religious affiliation, or I don't know the proper term for that?
Dan, go ahead. Would you be willing to talk to this, please?
Sure. So the answer is not a very satisfying. It depends, because it depends on whether they're educational facility or if they're leasing to faculty or et cetera. There are certain different categories that allow for tax exemption, and they all have their own requirements. And so until we know exactly what their use is, we can't speculate if they would be tax exempt or not. SVC was tax exempt. So if another educational facility, college or university took it over, it would continue to remain tax exempt. As you know, religious organizations do often enjoy tax-exempt status, but it does depend on what they're actually doing with the property. For instance, they couldn't, not that I want to make anybody worry, but they couldn't rent out all the dorms as condominiums and avoid taxation. If they were to establish a school up there and those dorms were used by students, then they would likely be tax exempt. So it really depends on what the final use of the property is before we can make, when I say we, before Johnny Antioni, our chief assessor, can make a determination of whether or not the property or portions of the property may remain tax exempt. It doesn't mean, just because a portion of it is used for tax exempt status doesn't mean that the entire property is tax exempt. There may be different uses in different sections. So it's not a yes or no answer, but I hope that gives you some context of how we would evaluate any use there as far as taxation is concerned.
Absolutely. Thank you for clarifying that for me.
You have other questions, Ms. Messner?
If I know that we were kind of blindsided by them occupying the space when they were, as they're renting it, if they were to plan to purchase that, would the town be notified, ahead of time and that sort of thing? And I think this was already touched on it a little earlier.
Yeah, but I'm happy to answer that. So we can't assure you that we'll be notified. We can certainly assure you that as soon as we do get information about a different use on that property, we would certainly look to make sure that the appropriate permit review, which would include Development Review Board review and approval, occurred. I can tell you that I have had conversations via email, and that our attorney has had conversations on the phone with the attorneys for the current occupiers of the site, that any purchase of the property and permanent use of that property by that entity would require a full permit review, including public meetings and review by our Development Review Board. So I did mention that earlier, but I can confirm that once again, that's what would occur. What I can't tell you is when the town would be notified of when this transaction took place. But as soon as we become aware of it, we would certainly work with the entity to get the proper review done.
Okay, thank you.
Thank you very much for your call.
Thank you.
Dan, do you want to touch briefly on bankruptcy, or do you want to avoid that altogether?
Well, I can touch on a little bit. That's not in all my area of expertise, and everything I've learned is through a very quick phone call with our attorney. But as far as the bankruptcy is concerned, it currently has been dismissed, and so there is no bankruptcy proceeding formally proceeding at this time. We fully expect, based on the comments of the former bankruptcy trustee, that bankruptcy will be refiled. Any purchaser of the property would welcome a bankruptcy or foreclosure, because if they purchase that property without those types of procedures, they would be taking on all the liability of that property, which they would not want to have to take on if they were purchasing the property. So they would be protected by a foreclosure or a bankruptcy. That being said, both of those processes would most likely require a auction. Even though there is currently a purchase and sale agreement on the property, we've been told, although we haven't seen it. It is very likely the bankruptcy trustee would look at that very closely, and if there was any interest whatsoever from a viable party to purchase a property at a price higher than what is already under contract for, it is extremely likely, based on the bankruptcy trustee's assertions, that a auction would be held. So I think we can look forward. I can't predict for sure, but I think it's very likely that we'll be looking to either a bankruptcy auction or a foreclosure auction before the property changes hands. Can't guarantee that, but that's my best guess based on conversations with our attorney and just based on past experience on distressed properties.
Thanks for doing that. That falls into the category of, I mentioned earlier, of things that's difficult to know exactly how it's going to happen, but we have a pretty good sense that when you say liability, what you really mean there is the debts. So people might have thought you meant liability as in getting sued, but what you meant is that there's a lot of debt on the property, and that going through the bankruptcy proceedings gets rid of some of that debt.
Right. So, for instance, that's exactly what I meant, Donald. Thank you for clarifying that. For instance, if the property owner were to, or the prospective purchaser were to purchase it for something less than the combined debt on the property, they would obviously look forward to, as soon as they purchase the property, the other debtors, the other lien holders coming right after them. So in order for them to have clarity about their debt going forward, they're going to need to deal with either a bankruptcy auction or a foreclosure auction. It's conceivable that someone might buy it and try to deal with those outstanding debts in a different way, but extremely unlikely given the amount of debt that we understand is currently have liens on the property.
Okay, so we have another caller waiting. This is a caller who's been with us previously tonight, so she knows what to do, but I'm nevertheless going to ask caller ending in 037 to please turn down the volume of her Cat TV listening device, and we'll enter you back into the meeting. Welcome, Lynn.
Hi, yeah, this is Lynn Mazza from Bennington again. I intended to let it drop, but I just can't. So what I heard was, if they had filed a complaint. And if they're going to file a complaint to a select board or a police department who aren't equipped to call racism when we all know in our gut what it is. So no, we have to, our lawyer told us that we shouldn't call this, we need a lawyer to tell us what racism is. So we're going to send this to the Attorney General, and hopefully he catches some bias this time. And then what if the Attorney General says that this wasn't racism or wasn't bias? Then all of us are just going to say, oh, okay, well, the white guy said it wasn't racism, so must not have really been that. I mean, this goes back to why we need a citizens oversight committee. I mean, if the police or the select board can't even call it racism, who's going to file a complaint to that? So yeah, I mean, my comment's two-pronged. We need citizens oversight because we need a group that's empowered to speak the truth and call things what they are. And we also need to be calling racism on every single level. We don't need to wait till the Attorney General makes his decision to speak what we know is in our guts. And I mean, Jeannie, you even acknowledged that that's your personal opinion. It's anyone who looks at its opinion, but yet we can't say it in a public forum. We need to start framing the conversation differently. And I guess I'll take my comments off air again.
Jeannie, I'm sorry to ping pong around.
No, that's fine. And
this is really more about process than anything else. So if you want to go ahead and take this, go ahead.
And Lynn, I hear the concern in your voice, and I share your concern. And the reason that we made the statement we did tonight is because many of us, me included, does believe that if the things that were reported in the paper are accurate, then it does feel like racism. So what I don't know, and I think none of us know, is really what happened there, because the only parties that were there apparently were the parties involved. So I can have my personal belief, and it's not shared by everyone in this community. And Bruce and Jean, you're welcome to speak if you wish as well, or anyone else on the board. But the point of this is that without a complaint, even a citizens oversight board would not be able to do anything here, because the purpose of the oversight board is to look at the results of a review of an incident that has been reported and charges brought. So the oversight board wouldn't have jurisdiction here, and it was not, So I hear what you're saying, and you can call it racism. Individuals in this, anyone in this community can call it what they see it as, but because we were not there, we cannot know. And that's where I will leave it. And I don't know if anyone else wants to speak or not.
Well, I just want to echo what you said earlier.
Yeah, excuse me, Jim, just a second.
Okay.
I'd like to let Bruce in first and Jean, if they'd like to go first.
Thank you, Donald. And sorry, Jim. I just wanted to clarify 2 points. One, I actually think the statement, when read, does say that it's impossible for us not to think of this as racism. It's impossible not to think of this as racism. But we don't make the determination about that. One of the, and it's not sending it up to the, it's not like a voluntary sending it up to the Attorney General's office. And Lynn, I would be happy to talk to you about it, but this is something that's required by state law, that it be sent into the bias incident reporting system. The AG's office is going to make a variety of possible determinations, and you know, because they're in COVID mode, they're not answering the phones immediately. But there are a number of options that they have, including bringing civil action and maybe something else. That's their call, but state law says that's what has to happen. And that's why we did it. It wasn't to pass the buck. I think the statement does say what a number of us believe happened, but it is a belief based on reporting in the banner. And I like to believe everything that I read in the banner. I think they do a good job, but I would want to know for sure what the folks there knew. And since that's not really possible, this is where we are at the moment. That's all I'd have to say. So those 2 points.
Thank you, Bruce. So Jean, I'm going to let you go briefly. I'm going to just warn the board, this is a bit of an unworn topic here. We're really talking about Southern Vermont College at this point. I think we're straying into something that if we want to have it be a separate topic, we should. But I've asked Jeannie and Bruce to weigh in. Jean, I guess you're part of this work group too, and I would extend the same invitation to you. Jim, we'll work you in, but be prepared to be extremely brief, please.
I will be.
Go ahead, Jean.
Donald, I'm happy to hold my comment. It's nothing earth-shattering or that eloquent.
Okay, thank you, Jean. Jim?
Yeah, I just want to echo what Jeannie Jenkins said a little while ago, is that we as a board, we haven't seen the report. So we really can't make, a clear and concise, we haven't seen the police report. So we really can't make a clear and concise judgment on this. It certainly does sound like racism, but unless and until we see that, I think it would be irresponsible for us to make a judgment. Thanks.
Okay, we are moving on here we have been through Southern Vermont College. There's a lot more to come on that, and people know what they need to do if they hear noise, but there's also reason for believing that things may work out, public access may work out, a sale may work out, so that there's a lot of things that we have to wait to see how they play out. But for now, I'd like to move on to the next agenda item. And this was driven largely by a request that came in at our last meeting, was echoed, I think, by you, Bruce. And
yes, it was.
I'm going to, when any board member wants to bring something up, I feel like it's the chair's responsibility, and the vice chair agreed with me on this, to try to bring it up. But I am going to take the liberty of reading Cassie's letter, which she sent to all of us first. It's a little bit long, but this is the opinion of the town clerk. The issue is whether or not during COVID we should allow ballot items for the March meeting to go through without the required signatures. And that's usually, is it 500, Stuart? 500 signatures, something?
469.
469 signatures, and generally thought the reason for that is to make sure that it's something that really means a lot to the community before you go through the effort of putting it on the ballot. So the question is, should we waive that signature getting process and let anybody who wants to put something on the ballot? And so this was the town clerk's response. She said, "Good afternoon, all. I understand there may be some discussion regarding petitioning requirements for local ballot initiatives. I've been in contact with Will Sinning, Director of Elections and Campaign Finance for the Secretary of State, and have confirmed, most importantly, there have been no temporary statutory changes to the Vermont law regarding this matter. Please note also that the Town of Bennington Charter states that petitions shall be signed by at least 5% of the voters. It's important to point out the word shall as opposed to may. This is a requirement in place by both state law and local charter. As a board, I recommend that you tread very carefully with this. This could very easily open a can of worms, so to speak. You all received an email last week from a woman requesting the select board defund the Bennington Police Department. Her address was Shaftesbury. Will she be able to petition to defund the police department? Will a resident who believes my election practices are fraudulent be able to petition for my recall? The petition signature requirements are in place for a reason. Please do not tamper with it. You will not be able to pick and choose if you waive the petition signature requirements contained in the charter. The person where this originally came from has already petitioned 2 of the last 3 years with negative results on the same issue that's been voted on 4 times. Petitions for local elections are not due until well into January 2021. There is certainly time for him to petition for his cause in the next several months while still maintaining safe health practices. His petitions are already in local shops. I understand he wishes to have this ballot initiative in place for the fall. This is a local ballot question and should be on our local ballot, the next of which is in March. While it will ultimately fall to the board to place it on the ballot, from a town clerk's perspective, a local ballot this fall is a poor decision and a logistic nightmare. Please feel free to reach out with any questions. So that's the letter that came to all of us on June 29th. So that's the town clerk's position on it, but I'm open to other board positions on this if some are forthcoming.
Well, since I'm the one that brought it up, I'll at least state a couple of things. First of all, I had already had this conversation with Cassie and appreciate her perspective. The only thing in her letter that is at least somewhat inaccurate with regard to my bringing it up was that the person she is referring to, I'm assuming we all know, is not the person who brought it to me and is not the person that raised the question to me. So whether, that particular person that she's referring to raised this with her, I have no idea. And I tried to communicate that to her in our phone conversation. Be that as it may, the person who raised that with me was asking a question. It was a question that I couldn't answer to some degree. And it was one that seemed to make some modicum of sense, given the decision by the Secretary of State regarding candidates and given the desire of the person I spoke with to raise an issue, which I'm not sure anybody here has seen because I know I haven't, at least not specifically in a petition. So all I'm saying is, from a health perspective, going out and getting signatures for a petition has precisely the same health detrimental effects as going out and getting petition signatures for running for office. And a perception that it will somehow be better in the fall or in the winter simply doesn't strike me as remotely optimistic. That's way too optimistic in my view. I'm not sure that we should legally do this. I think I wanted us to have a discussion And noting the time, I'm not sure that now is the time to have an open discussion, but I much prefer having open discussions about items such as this or questions such as this than I do having just quiet behind the scenes conversations with each other. That way the public understands we're really considering something. Thank you.
Thank you, Bruce. Are there other thoughts on this?
Are we going to discuss it tonight, or is it going to be tabled for tonight?
Pleasure of the board. We have a few other things to discuss tonight. Manager's report, upcoming agendas, meeting location, other business, and public comment still. Go ahead, Sarah.
Sorry, my hand raise function does not work. So if I'm just raising my hand, that's why. So I've been kind of going back and forth with this. If we could just table this, discuss it another time, I think that might be the best. Is anybody in the room with that or disagree with that?
I'll second that.
Okay.
There are two callers that are waiting to get in. I expect we know who at least one of them is, but we could take those calls if we want. I'm not sure if that was a motion, Sarah. I mean, it sounded like you made a motion and Jim seconded it, in which case we are not taking calls.
Because it's not debatable.
So, was that meant to be a motion?
Did not make a motion. It was just a suggestion. I can make a motion to discuss another time.
Why don't you wait? Why don't we let people into the meeting, hear what they have to say, and then we have warned this topic, so let's at least give people a chance to talk. And even if we decide to table the issue, we'll do that later. So is that okay, Jim? I know you felt like you were seconding something there.
Yeah, I just think that, this is a big topic, and I think we need to devote, a considerable amount of time to it. And we're already pretty darn close to 2 hours. We haven't even gotten to the manager's report yet.
I know. Okay. Caller ending in 240. I've entered you into the Bennington Select Board meeting. I'd ask you to, at this point, to turn down the volume on your CAT TV feed. And I'll unmute you here in just a second. And please introduce yourself and tell us what's on your mind. Welcome to the meeting, caller.
Oh, are you talking to me? Okay.
I am talking.
Yeah, this is Francis, 4240. I got a question. There was something in the banner about this guy saying he spent $300,000 on electrical work today. So how come nobody knows that he spent that money and he's doing electrical work? Who spends $300,000 for 6 weeks on electrical work?
Dan Monks, would you like to talk about any electrical permits that were pulled?
Well, first of all, we don't administer electrical permits. The state of Vermont does, but I can imagine where that work. I certainly can't speak to the $300,000, but I do know that there is an electrician that's working up there diligently to take care of all the fire and life safety issues, new smoke detectors, new fire alarms, all of those sorts of things. So, there is a lot of electrical work going on. I know that the electrician is a very reputable firm and is known for following all the rules and pulling all the permits with the state. So electrical work is something that we do not regulate. It's regulated by the state of Vermont, but there is a licensed electrician on site addressing all the fire and life safety issues that were identified by our building inspector. So I guess that's all I could share on that.
Okay, but that may be question. Mary Morrissey asked a question about is any work being done? What's the truth? What's not the truth? And there is. The guy spent in the paper. He spent $300,000 on electrical work, but this is only for a temporary camp. So when this is all done, he's going to undo the electrical work and take his equipment out.
No, I believe the issue was whether or not work was happening on the mansion and associated properties adjacent to the mansion, like the bookshop. We have confirmed by visual inspection that there is no work being done on the mansion. There has been work all along. In fact, that's how we became alerted to the issue in the first place. And someone called and said, hey, there's some work happening up on the campus. And that work is mostly, we understand, based on our inspections, electrical work for fire alarms and other life safety measures. So there never was any assertion that there was no work going on there. It's just there's no work happening in the mansion itself.
So how does a tenant spend $300,000 on property he doesn't own? Doesn't that raise any issues with people listening to that?
Well, to be clear, that I mean seems a little odd, right? But he does have a purchase.
Seems a little odd. It seems like there's something else going on that nobody's aware of.
Well, as I say,
seems like the properties. Yeah.
He does have a purchase and sale agreement on it, and so that purchase and sale agreement would have meant that they would rent the place and then they would buy the place until it went into bankruptcy, and then that changed the equation some. So I think it's in the category of things that I agree. It doesn't make complete sense. We don't entirely understand why that would all happen, but I do know that there's something like 500 bedrooms in the dorms, and ionization smoke alarms are all now illegal, and I can imagine all of them had to be replaced. And I don't know, but it seems pretty easy to imagine that they had to spend a lot of money getting those dorms up to code for a summer camp.
Donald, it's just mind-boggling. Everybody seems to be amazed. They can't figure it out. It does seem odd, but nobody thinks that there's an issue here that's not clear, that somebody knows something that's not being addressed. I mean, there's an awful lot of obfuscation here, really. I don't know anybody that would spend $300,000 on electrical work for a summer camp, okay? They come down from Rutland. They got kicked out of a motel up in Rutland, all right, for renting rooms for 300 people. They bring in 500 people, then 18 buses show up at the Southern Vermont College. And these people are doing what? And then you have that article that came up in Facebook or wherever it was on the internet about this Rise Up Ocean County.
Yeah, Rise Up Ocean County.
Everybody dismisses this, and they don't see what's coming down the road here.
Rise Up Ocean County has been absolutely sanctioned for being a anti-Semitic group, and they've been taken off of Facebook.
No, that's not. Yeah, that's what people said. All right, because they referred to the people that were Hasidic that were down there in Lakewood, New Jersey. All right, and what did they do to the town? That's where it all came from. Rise Up Ocean County, because they destroyed that town down there.
We're not giving any credit to Rise Up Ocean County. We are not giving any credit to anti-Semites like that. So that is not.
We're going to have a conversation. They're not even referring to the people. All you got to do is get the press reports. All this stuff is out on the internet. The actual press reports from Ocean County, New Jersey.
Sir, we're not going to have this conversation with you. If you want to talk about smoke alarms or you want to talk about electrical work, we will have that conversation with you. What we know is that they have put a lot of money into that place. A lot of money needed to go into that place. It is a mystery whether or not that would be worth it for one summer of summer camps. But again, they had a purchase and sale agreement signed, so they could have assumed that they would be able to go through with that purchase and sale agreement. Bankruptcy interrupted that purchase and sale agreement. Bankruptcy is now off again. Bankruptcy may go on again. So we don't really know.
The bankruptcy thing was withdrawn. And according to the trustee, he was prevented from going on the property because they didn't know who he was. So he wasn't even notified.
Yeah, the bankruptcy dissolved, but could be brought back and is expected to be brought back again.
Well, I guess the religious organization has an awful lot of tax-free money that they don't have to pay taxes on, and they can spend $300,000 on electrical work on a flyer. No sane business person would do that.
Well, listen.
And if people can't see the forest from the trees, I don't know what's out there. Tell you the truth.
Okay. Well,
maybe a year from now or 2 years from now, people will investigate it, and there'll be something going on about that. Find out what happened. How come nobody knew? Okay. Have a great day.
Okay.
Excuse me, Donald. I don't know what Francis's last name is.
I'm sorry. I'm sorry. I failed to get that.
Oh, okay. All right.
Donald, I think that it's important that we note there's no evidence as to how much money was spent there. I mean, we're acting as if that $300,000 number is a real number. There's no evidence of how much, and we certainly wouldn't know, and nor are we entitled to know. So I think we just need to state that for the record.
Yep. I think future investigations, whatever you mentioned, would show that the town has been very much on top of this and making sure every permit that is required is filled out. Now, it may feel to some people that getting permits is not enough, but that's the extent of what we can control. So that and ordinances, if ordinances are not abided by, and we're working on the noise ordinance as well. I have one more caller I'd like to bring into the meeting. I think this is, we'll see what this call is about, but this may be about signatures. This may be about Mock College. I'm not really sure, but caller ending in 196. Welcome to the Bennington Select Board meeting. Glad to have you here. I'm going to ask you to turn down the volume on your Cat TV feed, and I'll unmute you in just a minute and ask you to please introduce yourself and tell us what's on your mind. And don't forget to give us your last name. Thank you. Okay, caller, welcome to the meeting.
Hi, it's Mike Bethel.
Hello, Mike.
How you doing?
Well, we're doing. How are you?
Barely. You know, I'm disappointed that you took the whole first half hour of the program to talk about the dangers of the virus, and you let the town clerk of our town try to talk you out of putting something that you legally can on the ballot. So I'm going to make it easier for you folks. I'm going to withdraw my request for you people to even strain yourselves to think about doing anything for the people of Bennington. I will go out and get the signatures like we did before. So one, you can get rid of that whole thought. Thank you, Bruce, for bringing it up. I appreciate it. I do want to say, I got a couple of questions for you, and maybe Dan, since Dan seems to know more than Stuart about what's going on in the town. Is there going to be handicap access to the stores in the Putnam block? Number one question.
Dan, I think we're straying slightly into citizens' comment here. So, but if you're willing to take this, I'd love to have you take it, please.
I guess the answer is the Putnam Block project will comply fully with the ADA.
It will have to, or it will?
It has to. It's the code review includes an ADA review, and that those permits have been issued.
To the front stores where there's no ramps now. So if somebody like in a wheelchair, myself or anybody else wanted to get into it, they could get into it.
Mike, I don't know the specifics of how they're complying with the ADA. I don't have that information, nor would I be, qualified to determine that. But I do know that the project must comply with the ADA, and access has to be, provided in accordance with the ADA. I can't tell you how specifically that's going to.
All right. The second question on the Putnam block is the second phase, if it ever gets going, is that still going to need a tip? Anybody on the board? Anybody on the board? Stuart or Dan? Anybody?
There's no way of knowing until when and if, hopefully, when the project proceeds. If we get a request from the developer, we'll certainly consider it. But there has been no formal request, and my understanding is phase 2 is not imminent at this time.
It's not imminent at this time. Well, that's good. I hope people listen to that. The other thing is, when is the splash park going to be done?
We're working with the contractors now to try to come up with a timeline. I don't want to speculate, Mike. We don't have commitments from anyone yet on when they can do it.
Well, I just wanted to know, because quite honestly, if you people would come out once in a while out of wherever you're hiding and hold a public meeting, you might get more general questions from the public. Every time we the public want to address you people, we have to wait for the end of the meeting. We have to listen to some kind of a nonprofit, or in this case, it was the virus explanation, where if there's anybody in Bennington that doesn't know anything more about the virus than this guy already told us, I would be shocked. But thank you for your consideration. Thank you for wasting 2 hours of my time listening to this. And you do not have to. I will go out and get the signatures. And if I get them in time, we'll put it on the November ballot. If not, we will put it on the March ballot. And by then, I'm hoping people will get sick of this form of government and this staff that we've got. Thank you very much.
Thank you, Mike.
All right. So,
manager report?
Manager report. What do you got for us, Stuart?
Well, not a heck of a lot. As you know, the PFOA projects are continuing. I received an update last week that indicates that contracts 5, 6, and 7, which are the ones dealing with Route 7A, Settlers Road, Russet Drive, Ashton Drive, the Apple Hill Complex, and some of the work on Willow Road and Automakers Road are all nearing completion. We've begun to connect homes. Frost Wells is pulling pumps from the old wells and closing them off. So we're really starting to see a light at the end of the tunnel with those particular contracts. Contracts 8 and 9, which are basically the Upper Chapel Road and Lower Chapel Road, and a little bit of the East Road north of crossover, are continuing, and those will most likely continue into 2021. A lot depends. We've had some good weather. Contractors are really pushing it, so we may have some better news as we move towards the end of the construction season. But right now, it looks surely like contracts 5, 6, and 7 will be completed, and all of those folks will have municipal water, or most of them will. There will be some that will remain on the point of entry systems, and there will be some that may have new wells filled for them because they just can't reach, or the town system cannot access their property safely with good water. So that's where we are with the PFOA. As I indicated, the wastewater treatment facility is really in the cleanup phase. The contractor is on site. There are some fairly large punch list items having to do with digester covers, but he is there and working, and we expect that will all be finished sometime, probably late fall, unless things suddenly start to pick up. Work is progressing, but slowly. As we talk, I think last time we talked, we were talking about bringing the financial condition of the town at the end of FY20 and the tax rates for FY21 forward. But we'll have those on the agenda for next time. So I've jumped ahead, Donald, I'm sorry, to next items, next agenda. But that's all I have on the manager report at the present time.
Okay, so we'll be good on the 27th then. Maybe it's a nice segue into upcoming agendas. Stuart already mentioned those couple of things that would be on the agenda. We will continue to have a community policing report as a regular standing agenda item. One of the things that I wanted to poll this board on a little bit is meeting location. And, it's notwithstanding Mike Bethel's comments, I did hear Trey say that the best way to spread the virus was to be, quote, indoors, close together, talking. So I want to be sensitive to the idea that not all board members may feel comfortable being indoors, close together, talking, but I do want to recognize that it might be easier for some people to get to a meeting if we did it in person. However, there could be people who don't feel comfortable going to a meeting in person, for whom this format works better. So I go back and forth a little bit. I think this is probably, inarguably, a safer way to do it, but perhaps a slightly more difficult way to allow public access. And so I'd love to hear from the board on what you think we ought to do. We have not come up with a good location, alternate location. The firehouse is still there for us, but it is the home of our first responders. The schools, we have not talked to them, but that is where our children all go. So I guess there's some reluctance to use those spaces. I see 3 hands, Stuart and Jeannie in that order.
Thank you, Donald. I should note here that we will have a brief scoping report prepared by Mark Andrews at Bennington County Regional Commission. They will be looking at possibly using the old abandoned trolley bed between Bennington and Williamstown for a bike path. And he needs a local concerns hearing. I tentatively told him the 27th might work for him. So that should be his potential for an upcoming agenda discussion.
Okay, let's add that to our agenda. Next item on next person is Jean. Go ahead, Jean.
Hi. So I actually am fine with meeting in the firehouse, especially because it seems to be the case, and correct me if I'm wrong, that transmission doesn't really happen from touching surfaces. So I feel like the board could very easily socially distance themselves. What really concerns me, though, is if we have a crowd of the public there. That, to me, makes it unsafe. If there were 10 people there, that's probably doable. So I'm wondering if we could look at and maybe get some advice from health experts on doing some sort of a hybrid where the board is meeting in person and we could allow a certain number of people. Maybe they could reserve a spot ahead of time if they knew they were going to be attending, and then also allow people to call in if they wanted to. Maybe just, you know, give them your cell phone number. Maybe that's a bad idea, never mind. Or we would have a conference call kind of situation. I don't know if that would be a logistical nightmare, but we're doing the training in that space, and I think it's probably a similar number of people, the board and a few more. So those are my thoughts. No,
we're doing the training somewhere else. But listen.
Oh, that's right. I'm sorry. I have a meeting there tomorrow. Never mind.
Yeah, you're on to the right tension there. It feels to me though, that what we might feel comfortable with, somebody else might not feel comfortable with. And I will say that I have had the pleasure recently of going into the high risk category for COVID-19 as a result of some fun and games with my heart. And so I am only somewhat anxious to be in a public setting during the COVID crisis. I know that sounds somewhat selfish, but I have some reservations about it. So if we can find a place that really feels safe, and if we can find a place that is comfortable for everybody, then that might work. If we could find a hybrid situation like you're talking about, where there's a way for some people to call in and some people not. I haven't figured it out yet, because in trying to figure this out with the Zoom thing, we have figured out how to have people call in a waiting room, bring them into the meeting and whatnot. But a conference call, the town offices don't have the capacity for the number of conference lines we'd need. We would need to get some kind of conferencing system and then make it available at wherever we were located. So I guess we could do some research on technologies for purchase there, but it does feel to me like there could be quite a few people who would not feel comfortable legitimately not feel comfortable coming to an open meeting in this pandemic. So I've got a couple more hands here. Jean Connor, your hand is still up. Maybe you're done, and then Jeannie Jenkins, and then Bruce.
Yes. Okay, so I agree with everything that Jean said, and Donald, with what you just said. I did recently attend an in-person DRB meeting that was in the firehouse, and the chairs were spaced apart, but it limits the number of people who can actually participate in person. So, and I think there's some people who will choose not to be part of an audience. Leaving was a little tricky. I understand we could have 2 exits, but for that meeting, there were 25 people all going down the same stairway and elevator after the meeting. And so I leapt up and was the first to leave because I didn't want to be in that crowd. But I think there are logistical issues, and I do worry about someone wanting to be in the meeting. And if they can't be in the meeting, then how do they, we need to have a way for people to call in. So that does seem to be a concern. And then I just wanted to raise, I think we have 2 other items for next time's agenda. Sarah, correct me if this isn't right, but an update from the opioid task force. Is that true? Yes. So they are on the next agenda. And also we were going to look at a street mural that depicts all Black Lives Matter. Yeah, so that's on the next agenda as well. And that's it.
Thanks, Jeannie. Go ahead, Bruce.
Well, just as someone who has been on the welcome to the club of being on the high risk category, I've been there since February or more. I'm I guess not too much worried about myself. I know if I felt uncomfortable, I could join electronically, but I am not. I would be really worried about reducing the number of persons who can participate or monitoring that. And I would have to be convinced that this would be in the best interest. I know that Zoom is not the best way. I heard Mike's frustration, I get it. But I also think that of the alternatives, this technology works about as well as we can safely. I really would want us to have any alternative looked at from a health standpoint, not so much for us, although I think that's part and parcel, but for the rest of the folks who are there. And, remember what we just heard this evening, the longer you stay in an indoor space with the folks who are there, even if you've got a mask on, and we would all want everybody to have a mask on, that would, it seems to me, would be required. That during the entire time, that it seems to me, it would be hard to get out of the red box. Let's put it that way.
Yeah, those are all good points, Bruce. Mike, Bethel, and I have a complicated relationship that involves a lot of going back and forth, as I'm sure he does with many of you. And I look forward to my next sparring with him on this. But I also feel his frustration with how difficult it is to access the meetings like this. And I agree that in-person meetings are much more fun, but at some level, if the problem is that it's difficult to wait to the end of the meeting to get heard, we also could consider doing citizens comment in the beginning and citizens comment in the end. I know that seems kind of like a lot, but if the reason we pushed it to the end was so that people would have time to telegraph the call-in information, and people would have plenty of chances to get the call-in information, and then we could deal with it that way. But if the problem is waiting to be heard, waiting through our our boring stuff, then we could think about making some kind of fix there. There is a part of me that feels like during a pandemic, everybody has a phone. If we could make it so that everybody can access the meeting by phone relatively easily, that feels to me like putting the fewest number of people at risk. Stuart, go ahead.
Well, I'm sorry to have to jump back. I know you hate this, Donald, but Mr. Bethel closed by saying that if he gets the petitions in November, then the ballot item would be on November. No. That is not necessarily true. The select board determines what vote the ballot item would appear at. And because it's a charter change, there are certain time limits for meetings, public hearings that must be held before the vote, that I don't think a November ballot is likely. And I would encourage the board not to think about placing it on the ballot. If you've read the story about what Cassie's going through with the absentee ballots at the present time, I can only see that increasing for the November ballot. And to throw in a local question, which would require a separate ballot, either some sort of way to program the machines or have to hand count them, I think that would be overwhelming and not necessarily justified. I think local questions belong at town meeting.
Yeah, it's a local question. We should talk about it at our town meeting. And if we had never considered this before and it was a burning issue, I might feel differently. We've considered it multiple times before. It's gone down in flames over and over again. So I don't feel that we should be making an exception for November on this. However, I'm open to the idea of having it go to the town meeting as many times as the public wants it to go. And we can just keep having it go. But I do feel like the signatures, having to get signatures is a test of seriousness, a test of earnestness. Without those signatures, anybody could put any stupid, dangerous thing on the ballot they wanted to. So anyway, I digress. Bruce, your hand is still up. Did you have something else you wanted to say? No. Okay, I'm going to lower your hand. You know what? I see a caller waiting in the waiting room here, so I know that this is Sarah. Go ahead.
I just wanted to pop back to the question of meetings.
Yeah.
And just comment, being the youngest member, I also don't feel that it's safe for us to go into meetings at the moment inside. However, if we did find someplace outside, I think that might be worth something looking at. If we were able to do that, obviously varying conditions of weather, but that might be something worth looking at.
Yeah, it's good. Good thought. We have rolled around a bunch of possibilities like the lower bays of the fire department, but that again is still our first responders. That doesn't feel right. So anyway, we're kicking around possibilities. Certainly entertain any great thoughts if people have them. I guess we don't have to decide this now, but it feels to me like the default for our next meeting is to continue with Zoom at least for the next meeting and maybe consider it then. Does that seem like the right approach to people? All right. Our next meeting will be on Zoom. We will bring this question up again when we set the agenda at the end of our next meeting. We're also having a meeting next Monday for a report on evaluation of a public officer. That meeting will be held by Zoom as well. So our next regular select board meeting, we have an agenda kind of shaping up here, Stuart, 27th, is that right?
Yes, it looks like we're filled up pretty quickly.
All right. So I'm going to say we could go to other business, but unless people have burning other business, I'd like to move maybe directly to public comment. Okay, Jean, go ahead.
Kayla took the time to send me an email about the rec center, and because she spent the time doing that, I really feel like I need to share what she said. I'll read fast. The facility, the
take your time.
Okay.
I'm sorry, I don't mean to rush you. The rec center's
okay. Okay, thank you. The rec center, she wanted everybody to know, will be closed August 17th through September 8th. This is for their annual scheduled maintenance as well as some additional construction work. And members of the rec center, if they so choose, they can use one of the other facilities that a Berkshire family-wide, another branch. And she's happy to take calls to help you navigate that. And the number for the Berkshire, the closest one, she has that. I'm not going to read the number. The pool reservation system, she feels is working really well. So that's people that want to use the pool. They have to sign up for a spot because there's only one person per lane. So it's a little awkward, I'm sure, but it seems to be working really well. And they're considering limiting or adjusting the reservation system to give members more opportunity to reserve a time. There's a new family swim time for children and an adult. So it's one child, one adult from the same household in the same lap lane at the same time. So she's trying to make the pool a little bit more accessible for children and their parents, or at least another adult. Those are happening Tuesday and Friday evenings from 5 to 6. And you need to call and make a reservation. She was very complimentary of her staff, that they're doing a great job cleaning the facility. Everyone's organized, everyone's helping. And the summer camp youth program at Willow Park is going very well. She's serving, or the camp is serving between 30 and 35 children each week. They're split into 2 groups, and she has extended hours in place for families that need care beyond the normal camp hours. And the counselors are doing a great job, and everybody's having a lot of fun. And then Jeannie, thank you for clarifying that she is getting the SVSU lunches delivered to the campers Monday through Friday. So I think that's it. Thank you, Kayla.
That's great, Jean. Thank you. Jim, I see you have your hand up. You got an update you want to share?
Yeah, it's under other business, and it's a very important one.
Yeah, go ahead.
It's a program that just started this morning, and let me just read to you. It's the COVID-19 Rental and Mortgage Assistance Program launch. The new Mortgage Assistance Program will be taking applications on Monday, this morning. The program, funded by the legislature under House Bill 966, will help low-income Vermont homeowners who have fallen behind on their mortgage and are facing economic hardship brought on by the COVID-19 pandemic. The program will provide up to 3 monthly mortgage payments directly to the servicer of the mortgage, with a goal of preventing future foreclosure. Administered by Vermont Housing Finance Agency, VHFA, the program is available to any homeowner who meets the eligibility criteria and is not just for VHFA borrowers. This program is not first come, first served, but instead will be prioritized to those who are lowest income and most at risk of foreclosure. Information is available at VHFA.org/MAP. That's Mary Adam Pickle. Also beginning July 13, the Rental Housing Stabilization Program. This is for tenants and landlords who have been affected by COVID-19. This is a first come, first served application process. And if you go to my Facebook page, there are direct links that people can click on for assistance. Thank you.
Thanks, Jim. I'm sorry, board. I didn't mean to give anybody the hook here, but if there's anything else you'd like to say in other business, go ahead. Otherwise, I have 2 callers that I'd like to admit to the meeting. Okay, so we're going to close out other business and begin public comment. And I have admitted a caller ending in 025 to the Bennington Select Board meeting for public comment. And caller, in just a minute, I'll unmute you, but I would ask you to take a moment to please turn down the volume on your Cat TV feed so that we don't have any feedback. I'll unmute you and welcome to the meeting. Please give us your name and tell us what's on your mind.
Hi, it's Nancy White calling, and I've got a couple of things. What is the capacity for the ground floor of the firehouse?
Do you know, Stuart?
That's not been calculated. That would have to be a calculation we made at the time. We do use it for boating, obviously, but that isn't anywhere near what its capacity would be for seating arrangements.
Well, I was thinking that when the fire department used to have Las Vegas nights in there.
Yeah, there's never been a formal calculation for that space.
Well, I would think that, wouldn't the state want there to be a calculation in case there was a fire? Because I would think if you were to open those doors and move the trucks out, right now the state says that 75 people can meet inside, 150 can meet outside. I think that would pretty much be an indoor-outdoor space. I can't imagine that citizens are going to be denied the right to meet in public, ask you questions face-to-face, and not get answers. Well, how can you expect this to go on for 2 or 3 years? I understood it during the shutdown, but there are so many things going on in Bennington that many people are unaware of. And you can't deny us the right to meet in public. You know that these online meetings, I could understand during the shutdown, but a lot of times it's difficult to hear. I think we could easily be holding these meetings on the ground floor. You could move the fire trucks out, and I think it's a solution that we've got to start to approach, and we have to start using now rather than later.
Yeah, I hear you on that one, Nancy. I think we're struggling with that one ourselves. And there's a little something funny about bringing people to the house of our first responders, as I say, but it is probably the space, except for the DPW, it's probably the biggest space that would accommodate that kind of a meeting. So you're right, we should be giving that another look and talking to the fire department and the state about that as well.
Well, nobody's going to be a stronger supporter of the fire department than I am, but the taxpayers of Bennington built.
Nancy, I don't know if you can hear us, but we can't hear you all of a sudden. You might have pushed the mute button on your phone.
No, I just want to say everybody in Bennington supports the fire department. The taxpayers.
Nancy, you're cutting out again. I don't know if this is our Zoom technology or if this is your phone.
It was. Can you hear me now?
We can hear you now. Yep, you may have a bad signal there.
Okay. Everybody in Bennington supports the fire department. Let's remember the taxpayers paid to build that building, and that building was created in part so we could use that as a meeting space for the citizens of this town. Nobody ever imagined that COVID would hit us so that we couldn't use the regular space. You have got to utilize that ground floor. Many citizens in this town have a wide variety of issues that they want to come and talk to you about face to face. We cannot be told that this may go on for another 2 years where we need to call in and we have very little chance for a follow-up. You have to start looking at using that building. And if we need to, I guess citizens need to contact our state representatives to put the pressure on the governor, because we can't be denied being held to calling in and trying to hear discussions, and there's a lot of charts and graphs we should see. I mean, we're all being shut out.
Well, Nancy, just to be clear, we're not talking about 2 years. We're talking about 2 weeks, really. We're just going meeting by meeting at this point as we try to figure this out.
But I think by now we should have been back at the firehouse.
Okay.
The other
comment received. What else you got?
Okay, the other thing, with everybody saying that Mike and his petition that it has to wait and go on in March, you already changed the scenario. The charter vote was supposed to be held at town meeting. Because you missed the deadline, you held a special meeting in June. You never should have held a vote on something important as the town charter in June. You only had about 500 citizens turn out to vote on those changes. I'll remind you, I was the only person in town that said that that ballot never should have gone before the citizens the way it was worded. You all said it was wrong. But when those changes went to the state level, they nearly threw it out because of the way that ballot was worded. So please don't say that if Mike gets the signatures, it won't be on the November ballot, because you've already set the precedent. You held a special election for the charter changes.
Okay, what else you got?
Well, that's it.
Okay, well.
All right,
thank you for your comment. Bye. Yep, have a good evening. All right, I know it's getting late here, folks, but I've got one more caller here I'd like to admit. And caller ending in 840. We've entered you into the Bennington Select Board meeting. We're glad to have you here. I want to ask you to take this moment to please lower the volume on your TV or computer or whatever you've got going so that we don't have any feedback. I'll unmute you. Welcome. I just would ask you to please give us your name and tell us what's on your mind tonight.
Yep. Good evening, Chairman Campbell and Select Board members. I always adhere to the rules and regulations set by the Select Board members, and I'm one of the few that do wait for citizens' comments. It's really hard, as you know, when you're in the loop waiting to be unmuted in Zoom because you can't hear what has been said prior to this. For citizens' comments, I do agree with where you stand. Keep it as it is. It's really hard to find a better location and accommodate the general public, especially at 50%. You don't know who's going to show up at a select board meeting. So stay steady is my opinion until things get better. One of my issues that I still bring up is, yes, I know there is a vegetation maintenance regulation or ordinance on the books. It's just that things move a little bit slowly. I know policy states that, you know, our inspector has to send out a letter and then wait on the property owner. I'm just seeing where the locations that are relatively visible to the public, it does not project a good image with Bennington when we see high grass. Another location is at the corner of East Road and Branch Street on that corner property with high grass as well. Even though that it's dangerous, a cigarette could be thrown and grass could catch on fire because of a drought situation. I hope that volunteers could do some community service, getting the okay from the town to maintain that property. We have a lot of volunteers in town, but I know you can't just go on to property without the okay from the town to do so. So you just have to kind of sit and wait. That's one of my concerns tonight. It's just very hard to do this the way you folks are doing.
Sam, do you think we should move the citizens' comment back to the beginning? Would that make it less difficult?
Well, it would, in my opinion, kind of pacify the ones that are impatient. You know, you probably get backlog, or, you know, if they want to comment on it, I know it holds up your agenda and you want to get through this. Probably you're almost going on close to 3 hours tonight. I know you get antsy at 2 hours. I know you do. You want to wrap things up at 2. But if you feel that's best for people to jump in before and after, I think it would kind of pacify people that, you know, can't wait till the end or get bored. I mean, I'm one of the few that do wait. So it's an agenda item. So it's your choice. You're chairman.
Well, thank you for your opinions. Thank you for your patience. I recognize that it's a pain in the neck to hang out in the waiting room on hold, waiting for your turn in the Zoom meeting. And I don't know of a better platform for this, but I'm sorry that it's difficult to wait.
No, that's just okay. It's the only platform. Can you imagine if we were doing this over phone? I mean, thank God we've got social media doing this. You folks are really getting in the groove into this. And, you know, to do comments, it's hard, and you get off track because, you know, you have agenda items, what you're going to be saying, when it can be heard. Everybody has to have a say. You got to go through select board members, and it just breaks up your momentum, in my opinion. So if you want to have comments in the beginning, try it, and also at the end. I think it would take the antsiness of, well, that's not a heck of a word, but pacify the people that just can't wait.
Well, yeah, and so pacification is not so much our goal as trying to make this platform as accessible as possible, contrary to what, you know, how some people might feel, but it's an imperfect situation. Anyway, thank you for your thoughts. We'll try to take that into consideration as we schedule our upcoming meetings.
Yeah, but I mean, you can try an outdoor meeting. The weather's nice, and of course, naturally, you don't know, a preempt thunderstorm could come up. I mean, if worst comes to worst, have it at Willow Park. I mean, it's under shelter. So I wouldn't do it at the base because, as you know, it's echoey as hell in the town of Bennington Fire Department. The acoustics are horrendous down there. So have a good evening, everybody, and we shall get through this.
Thank you very much. Okay, so board, we punted on a few of these things that we're going to continue to monitor meeting location, and we'll take up the signature thing again later, if that's the pleasure of the board. But I think that's it for tonight. So I would, unless there's anything else that people have, I would look for a motion to adjourn.
So move.
Thank you, Bruce. Do I have a second? Thank you, Sarah. All in favor, please unmute yourselves and say aye.
Aye.
And there's a dog going off too, so that must be,
that's my dog.
Somebody needs to get fed. All right. I'm sorry this meeting went on a little bit long. I'm sorry if I got a little impatient towards the end, but we got through it. We'll keep going, and we'll talk to you all very soon.
Thank you, Don.
All right. Thanks. Thank you, Cat TV, for making this possible. Have a good night.